Hello, everyone. Welcome to Patriots 3, Life, Liberty, Pursuit of Happiness. And here's your host, Tim, and our special guest, Dr. Sheila Furey. How you doing tonight, Sheila?
I'm great. Happy to be here.
Great to have you on board. We've had some wonderful conversations in the last couple of weeks. I'm excited to jump into this, but just a moment here. So I'd like to remind our audience to go ahead and give a like, share, and follow at Tim Holliday TV. That's TimHolliday TV. You can listen to us on iHeart, Spotify, Apple Podcasts, and also watch live on Tuesdays and Thursdays, 9 p.m. Eastern, 6 p.m. Pacific. You can find us on Rumble, YouTube, Facebook, and Twitch TV. I want to give a good shout out to my friend, Pastor Jerry Cook, with Politics in the Pulpit. And we'll be talking about the pulpit in just a few moments here, because we just had a good conversation about that. But yeah, Pastor Jerry actually had a really good show yesterday. Well, he has great shows all the time. He covers a lot of in California as well as in the nation. But yesterday he actually talked about the root problem of socialism from a pulpit standpoint. Really wonderful. Yeah, definitely be sure to check that out. I'll be dropping the links into the chat and also in the show description on how you can find out a little bit more on Pastor Jerry Cook and Politics in the Pulpit. So, Dr. Sheila, we were talking about the pulpit right before we went live here. Let's enlighten the people a little bit more about how the pulpit should get a little bit more involved.
The pulpit needs to be involved. The founding of this country was based on religious liberty, and we need to reclaim that religious liberty and not be frightened. The whole concept of keeping politics and religion out of discussions because people might be offended is costing us dearly as a nation.
Yes.
And what we should do is actively discuss politics and religion, because it is only in the active discussion of that we understand the framework and can begin to look at ourselves and our lives and our families and see the influences of both politics and religion, and the inherent guidance that we need from religion and religious philosophy, morality. Because a nation without a moral foundation is a nation that's completely lost. And we as a nation are seeing that every day now, as people want a fluid morality. It's whatever I feel or think on a given day. And it doesn't, as long as I feel that my morality is okay, I should get a seal of approval. And that's completely wrong. We need a standard. We need a standard that calls us to be individuals who seek a higher ground and who are not going for the lowest base or common denominator as acceptable.
That's absolutely right. I've been having this discussion on my Tuesday show with my co-host Matt about principles and morale, and you get a lot of these from your churches and religious organizations. You got to have these principles and morale in order to make a sound choice. The pulpit definitely needs to step up, regardless of what Lyndon B. Johnson did with the 501c3. We still have our First Amendment rights.
We absolutely have our First Amendment rights, and that it's so critical that we do not lose those, because it's not just about the ability to speak and have our voices heard. It's also about the ability to hear what is being said. And that's particularly through important in medicine, because what we saw in medicine was doctors being shut down completely, losing their voice, being told by their corporate entities that they could not speak, that there was only one role that they played, and that was to speak the corporate byline. And that's completely unacceptable, right? Because your patient needs to hear, what are their options? What do you think? And what is your discernment as a physician? But what is all of the information available? Not just a select subset of the data that you have been told to give me.
Yeah, that's absolutely right. I remember 2 doctors in Southern California, I believe it was, they were actually just shut down on social media. Their accounts completely closed. And it was terrible to see because they're actually exposing a lot of truths when it came to the recent pandemic healthcare. And we were great to have some frontline doctors. One of my good friends actually was a frontline doctor, and I worked with some fabulous nurses this past year, and actually had one of them on about a month ago at Nurse Kimberly Overton on. So always good to have some good people stepping up and speaking the truth. I mean, it's a little, I don't know, in some ways it's not easy, but then again, it's not hard either. Speak your heart.
Absolutely. And here in Virginia, we had a particularly horrible case. And this is of Dr. Paul Merrick, who is the #2 leading physician, most published physician in the world.
Yeah.
And because he spoke the truth and wrote about the truth, he lost his job. All right.
Wow.
And the man who was saving lives, and all over the state of Virginia, throughout the country, throughout the world, it was the physicians who were saving lives that were being fired from their hospitals, from their clinics, being told that they could not speak, that there was only one cure for COVID, and that was the vaccine. And we could treat it with remdesivir, which was toxic. And so the game plan that was set out by Fauci, the Gates Foundation, all of the moneymakers, the pharmaceutical industry was in play. It was set before the first case even occurred.
Yeah.
And the lies were so built in, and that the mainstream media picked up on that. The medical establishment was part of that. And the fact that the medical establishment was so dishonest, and because money was more important than the lives of human beings.
Wow. I remember, I believe it was in 1976. I believe it was the swine flu vaccine they tried coming out with. I wish I grabbed that video to show the audience. But there's just so many deaths, and they just went ahead and chopped that off. They didn't even push forward with that as they did with the this what do we call this? Operation Warp Speed.
Correct. But the deaths that were ignored and continue to be ignored,
yeah,
that are occurring, the fact that we are giving it to children to this day,
yeah,
is reprehensible at the best. All right. And I believe that those physicians who are continuing to inject children should be tried for malpractice.
Yeah. So
it is absolutely unacceptable. There was never a risk for children. And when we know that there are safe and effective alternatives that can be used, the fact that the American Academy of Pediatrics continues to support the use of the COVID, shot, because it's not a vaccine, it's gene therapy.
Yeah.
And it just speaks to the corruption within that entire organization.
Right. And a vaccine is supposed to, be, partial live vaccine, and it's supposed to, your body's supposed to build immunity. Well, I mean, why is there so many boosters in such a short period of time that that's the case in situation? And if someone's received the vaccine, and if I don't, wouldn't they be safe anyway? And there's been this huge argument when it comes to that about, everyone should have a vaccine. And I'm like, no. There was not enough case study and research done on, this gene therapy, which is not a vaccine.
Correct.
And this is one of the reasons I didn't receive any of those. In fact, the last vaccine I received is in 2014, and that was the flu vaccine. And it was the worst I've been sick in a long, long time. I don't want to get in the description of that. That was terrible.
And I think the whole vaccine industry, all right. So when they got in 1986, they said we're going to indemnify them essentially and allow them to make vaccines and more vaccines without being held accountable. And we're going to have this system that if somebody is harmed, we're going to, provide compensation to them. It was all a lie. All right. And the doctors, again, that spoke out
Yeah.
are doctors who lost their jobs.
Yeah.
Right. And the doctors who continue to speak out and look at the childhood vaccine schedule and even ask simple questions about the vaccine schedule. You're called an anti-vaxxer and that you're dangerous and you're hypocritical. And how can you be in the field of medicine? Because vaccines have saved lives. Well, let's look at the evidence. Did vaccines actually save lives? And the evidence does not support that.
Well, to my knowledge, there has not been any true testing of vaccines. The placebo testing or double-blind placebo testing, and
that's correct.
It's absolutely terrible. So, I mean, I remember in the late 70s, early 80s, there's to get these carbon monoxide detectors because of SIDS, and now kind of learning different that it might not have been carbon monoxide, but it might have been the vaccines, the vaccine schedules, because it all kind of matches up around. When they did that increase of vaccine schedule at, I believe it was 1983, or was it 86? I forget.
86. But okay. The issue is that SIDS, when the vaccine industry, when you look back, to the 1960s, when vaccines were really 50s and 60s, okay, even then, we didn't have a formal diagnosis of SIDS until the vaccine schedule was fully implemented. Right. And the work, Pierre Corey has actually spoken extensively about this. Steve Kirsch is also. And when you look at that vaccine schedule and you look at when did children begin dying of SIDS, within 24 to 7 days of a well child visit. Yeah. Well, that's disturbing. So that the children die either immediately or they have sort of a, neuroencephalitis that develops and then they die within 7 days. Wow. So it's very disturbing. And it really makes me rethink my entire training. All right. And that, not fully looking at, what are the other reasons and being asked to legitimately ask questions and dig deeper. You're so used to, and you're trained, you want to be the best. All right. You want to be the top of your class. How do you do that? By getting all the answers right, by following all the rules, by jumping through all the hoops. All right. And so as you do that, are you then losing your inquisitive ability, your ability to challenge authority because you have been trained for so long to do exactly what authority wants you to do?
Yeah, you got to think outside the box, or in this case, think outside the book.
Yes.
That there's different methods, different treatments. Where let's take ivermectin for example. That was actually an alternative to use to treat COVID versus remdesivir, and that wreaked havoc on the kidneys, and it did a lot of other things to where ivermectin, someone won the Nobel Peace Prize on that.
Correct.
It's very interesting on how they tried to blackball that medication, calling it horse paste and all these other names, trying to push it aside, get it out of the mainstream media, and trying to tell people that they shouldn't take it. And ivermectin is prescribed for lice, it's prescribed for rosacea, but it's also been found to help out with the actual cure for COVID.
Right. And so what they said to you was remdesivir was the answer. Remdesivir was a drug created by Gilead. It was used in the Ebola trials. And in the trials to treat Ebola, its arm of the study was stopped because of the high mortality rate. Yeah. Okay. But the Gates Foundation had a lot of money in Gilead. And so along with Anthony Fauci, they resuscitated remdesivir, and this was the answer. This was the cure when they knew it had a 50% mortality rate. All right. And ivermectin versus ivermectin hydroxychloroquine. All right. Low cost, repurposed medication that have antiviral, anti-inflammatory properties. because people weren't just, when people were dying, they were dying of inflammation.
Yeah.
And the inflammation, particularly in the lungs. And so how do we decrease inflammation in the lungs? High dose steroids and other mechanisms of action. We had, when Pierre Corey first testified before Congress about the use of high dose steroids, I celebrated and I said, oh, good, this is going to be over. Yeah. Wrong. All right.
Wow.
And so all of the training that we had as physicians, all right, to treat, an inflammatory lung disorder was thrown out the window as if we had never had that training.
Wow.
And so this was the disturbing thing. So initially, my feeling as a physician, and even though I'm not in a hospital, I had a lot of intellectual curiosity. And I was saying, okay, this is great. And we had Facebook pages and people were having active discussions about how they were treating and what they were using it to treat and what was working and not working. And that I thought was wonderful. And then all of a sudden it stopped overnight, gone. And the same thing occurred after the genetic gene therapy rollout.
Yeah.
When you had all of the Facebook pages, particularly young college women who were talking about the menstrual dysfunction following the shots, shut them down. And so the government control, that should frighten everyone because it didn't just disappear. All right. So people think, well, now that Elon Musk has control of, X, that everything is better.
No, it's not.
We know that it's not. And all you have to do is simply post something on Nextdoor, or something benign, and it's immediately taken down. People are taken off Facebook all of the time.
Yep.
Well, your ability to speak and your ability to speak even as a professional,
right,
is not, you're like, okay, am I risking my job by speaking out?
Right.
And when I was early in my career, one of the things that I think I celebrated the most was being at grand rounds and having physicians having active arguments. All right. Taking two sides, and they were willing to fight tooth and nail for their opinion about what they were seeing in a patient review. And that appears to have completely disappeared. That, okay, we have the party line and you are to follow that.
Wow. Yeah, that whole party line thing is just, people need to step away from that. They need to actually look at things as the truth, not just, this is better than the other, blue is better than red or vice versa. They need to step away from that mentality. Mm-hmm. I've been talking with my co-host on Tuesday, Matt, about that. And, it's great that we have a great open discussion on that on Tuesdays. So when it comes to Anthony Fauci, we're going to rewind a little bit in history here. I'm going to play a short video clip from Joe Rogan, actually, and I'll drop a link to the YouTube where I grabbed this from. We're going to give a little history on Anthony Fauci and his involvement in the HIV/AIDS pandemic, and some things that have resurfaced again, and then we'll continue on with good old Mr. Fauci and some of the recent things going on.
Also, then if you read RFK Jr.'s book, The Real Anthony Fauci, you find out he ran this exact same playbook during the AIDS pandemic. It was the exact same playbook. That's what the Dallas Buyers Club is about. The Dallas Buyers Club, that McConaughey movie about AIDS, the fucking villain is Anthony Fauci. He's the guy that's stopping them from getting alternative medications. That's the guy that wanted everybody to take AZT. You know why? Because AZT had already been approved. They had already used it as a cancer medication. It was a chemotherapy medication that they stopped using because it was too deadly. It was killing people quicker than cancer was killing them. So the first medication they gave people when they had an immune system that was compromised was a chemotherapy medication that was killing people. And they were giving it to people that were asymptomatic. They were giving it to people that tested HIV positive. And then you know about the PCR testing.
So the Anthony Fauci's involvement with that, the AZT, that was just, to my understanding, it caused quite a bit of harm.
Absolutely. It caused death. All right. And this is really disturbing. When I read, Robert F. Kennedy's book, this was probably the most painful chapter for me, because I was in my training during the height of the AIDS crisis. And I had, young people, young men my age, who were dying of AIDS. It was, something I wasn't prepared for, but that was the situation I was in.
Yeah.
And I just never imagined 27, 28, 29-year-old kids dying from AIDS. And yet that's what was happening. And they were all on AZT. But at the other end of the spectrum, I was also worked or did some rotations in a pediatric AIDS clinic where they were giving young children AZT.
Wow.
All right. And so it was fundamentally disturbing and criminal that particularly children who were in the custody of the state were given AZT and they were dying, and no one was stepping in to stop it.
Wow.
Because they were literally the experiments of the government.
That is disgusting.
And this is one of the saddest parts of what our government does. Who are they experimenting on? And doing it all under this guise of, we're providing health care to the unfortunate. That is not what they're doing.
That's not healthcare either.
That is not healthcare. All right. And some of these children may have, if they were born to an HIV positive mother, it was just assumed that they had AIDS. They may have tested HIV positive. Okay.
Yeah.
But that doesn't mean that their immune system was compromised. Okay.
In a lot of cases, and correct me if I'm wrong, I might be, because I'm not a doctor, but typically a mother does not pass the HIV or AIDS over to the child. Is that correct?
They may or they may not.
Okay. So it's kind of a 50-50 situation.
And
I'm wondering, my question is, how are children getting, the HIV or AIDS symptoms? So there's a 50-50 chance that they might have it.
And they might test positive at birth. Okay. However, they might be able to clear the virus on their own.
Oh, okay. Wow.
And so that aspect of it was not looked at. Wow. Okay. And, could you just allow the child to develop and see if they become symptomatic?
Yeah. Or
do you begin a toxic regime of treatment as soon as you can?
Wow. I mean, that sounds like the HPV vaccine. They're giving it to infants, and that's a bloodborne or needle. Yeah, sexually transmitted or bloodborne disease.
That's hepatitis B. Okay. Yes. But HPV is similar, sexually transmitted disease, and yet they want to give it at younger and younger ages. And yet they're not recognizing the tremendous amount of harm that this is doing to young girls and women.
Right. And to my understanding, it also has effects on boys and when they grow into men and their fertility. It's just terrible on all that. A friend of mine, Nurse David Wayne, did extensively on what was it, the AmericaOutloud.news with the nurses report. He went in like 3 different episodes talking about the HPV vaccine and how detrimental that is to not just girls, but also to boys.
Correct. The fact that they extended it rapidly. So initially it was only girls to get it, and then it rapidly went to boys. And as far as I know, boys don't have a cervix. Okay. Right. But they can be carriers of the virus. I understand that aspect of it. However, what they're not looking at is the body's ability to clear the virus. Right. They're also not looking at virus's ability to change. And when I was in training and we were looking at cervical cancer, herpes was the cause of cervical cancer. All right. And so if we really want to look at it, it's chronic inflammation that is probably the cause of cervical cancer. Yeah. And if you have chronic sexually transmitted diseases, you're at higher risk for cervical cancer. Right. But now we're giving, this so-called vaccine. Yeah. And we're looking at young people who are having severe neurological injury or death related to a shot for a virus that doesn't kill.
Right. Yeah. I mean, I believe it was late February of 2020. I might have had the so-called coronavirus. I felt like an elephant was sitting on my chest. I was down for a good 11 days and didn't get tested. So I can't determine that to be truth or not. But because everything was still fresh right then, and it was actually about 2.5 weeks later we were on complete nationwide lockdown. I was in terrible California at the time, and it was again one of the worst. I've been sick, but I've had a little bit of touch, some lung issues, but not nearly as bad as that point in time that I recall in my life. The test, the PCR test. Now, to my understanding, that'll amplify even a non-animate object and say, hey, if you're looking for this, it's here. And it's terrible on how they just overuse that, and they're not actually testing for the antibodies, which will determine that if something is present or not, antibodies will appear. Is that correct?
Correct. It's looking for part of the viral chain. Well, when you're looking, it was never designed. And the maker of the PCR test said it was never designed to diagnose.
Correct.
And yet we are using it to diagnose. And what is really shameful is I will have patients who go into the emergency room, they will get tested and they'll say, yeah, I've got COVID, I've got RSV, and I've got the flu. And I said, no, you had a bad test.
Right. Yeah.
All right. I'm not denying that you're not sick, but you do not have all three of those viruses at the same time. All right. That shows a faulty test. And when, all of the people who waved it in the air and it tested positive. Okay. I have a colleague who ran a clinic and ran a small surgical center, and everyone on a particular day came back positive for COVID. And he called them up and he said, statistically, this is impossible. So you must run all of the tests again. They call him up and say, they're all negative now.
Huh.
All right.
Yeah.
Okay. So they were, the amount of fudging of numbers was huge and remains huge. The fact that they, if you called a lab and said, I want to know what your cycles of amplification are, all right? So the higher the cycles of amplification, the more likely you are to have a positive test, okay? So, if we beat the rock long enough, all right, it's going to become something else, all right? And they wouldn't tell you. We can't tell you what the cycles of amplification are. Well, I ordered the test. Do you think that as the ordering physician, I want to know what the cycles of amplification are? I'm sorry, we can't reveal that data. We can only reveal the results.
Wow. That actually just, kind of takes away some of your abilities to be a doctor.
Correct.
That's just terrible. You should know this information so that way you can inform your patients proper. And they actually took that away. What are these higher ups or supposed higher ups are doing to our medical society?
Well, it's all about keeping the patient in line, taking the money, getting the money. It's a fraud scheme.
Yeah.
The entire medical industrial complex is based upon fraud. It isn't based upon, there are good doctors, there are good nurses everywhere, okay? If they were allowed to do their job without interference from, the corporate CEOs who are only interested in their for-profit interest, we would be a healthier nation.
Well, I mean, I've seen hundreds of doctors and interns for my dis-ease. They gave it many different labels, like spastic paralysis with unknown etiology, familial spastic paralysis. And the more and more I look at it, it might be vaccine injury related, because a lot of things happened around that time frame when I was a child. But I could see, with a brief conversation with a doctor, I know of a good doctor versus not a very good doctor, or a nice person just trying to play the role, because they don't think outside the box or outside the book, as we were talking about earlier. And I could actually tell you're a good doctor because of our conversations, not just because you're pleasant to get along with, but our context of what we talk about.
Yeah, I want to understand and help people. I want to try to understand. I'm a psychiatrist. I see patients with complex medical illnesses, and I don't know them all. They come in and they're like, I got this. And I'm like, well, I got to do some research. And that's my job.
Yeah.
Okay. If I fail to understand the nature of their illness, the medications that they're taking, the impact that they may have on them, not only physically, but psychiatrically, then I'm not doing my job. All right. They might as well go down the street to somebody else.
Yeah.
And that to be able to listen to them and understand how they're struggling, and how they're struggling also with just their interfaces with the mainstream medical community.
Yeah, it's a lot. It's a lot. And doctors, unfortunately, today have to play this interesting role of, trying to be a doctor as well as like an insurance broker. And that's really unfair to the doctor, because their sole job should be to treat the patient regardless of, this whole money thing. And, medical coding gets involved and gets in the way because, we didn't code it right. So we got to, run it through again under something slightly different. So one of the most recent diagnoses I've had was a spastic paralysis, cerebral palsy. And I'm like, well, wait a minute. Aren't you supposed to be like born with that? None of those symptoms were there. That's quite interesting. But I mean, it's just, I think it's for the insurance game of what they have to do in order to get paid. And, whether it be a private insurance or, Medicare, Medicaid, state Medicaid, to my understanding, the state Medicaid does not pay out very much. So I can understand why doctors don't do that. So what's your insight on that as far as
I think what patients have to understand is there are multiple people present in the exam room other than just the doctor and the patient. And that is, there is the Board of Medicine, okay? There is the pharmaceutical industrial complex. There is the insurance company. If you're part of a hospital system, they're there in the room too. So the government, clearly, because of all of the billing codes, Medicare, Medicaid, all of that, they're all in the room.
I've seen doctors' names that I've never seen in person in my 3-inch thick chart. And that's only part of my chart, because when things transitioned over to the electronic digital, a lot of it was lost, unfortunately. I'm glad I have the paper copies, because those don't exist anymore in the digital world.
And I think what is important for people to know is and how to advocate for themselves and for their family members.
Yes.
And so keeping your own binder of your own medical records, all right, is really important, particularly if you have a chronic illness, so that you can track your own illness and understand. My labs were here a year ago, but look at where they are now. All right. These are the interventions that have occurred in the last year, because your doctor may not be the same doctor from visit to visit or year to year.
Correct.
And even within a hospitalization, okay, so say you're hospitalized for 7 or 8 days.
Yeah.
I have a friend of mine who went into the hospital. They had a different hospitalist for the first 5 days of the hospitalization.
Okay.
And so when I would be there to visit, and they would come in and say, well, how are you doing? Well, the first 3 days, they were delirious. And so they had no recall. So on day 4, when they're really with it, and they're like, well, tell me about the first 3 days, they can't answer that question legitimately.
Right.
And yet they're seeking the answer from them, and they're not looking to the chart. And, so luckily I was able to give the bullet points for the patient. But had I not been there, you're trying to recreate things out of thin air.
Yeah.
And that shouldn't be.
Nope.
And, I'm old enough to know the old-time doctor who did hospital rounds in the morning and went to the office in the afternoon.
Yeah.
And the medical profession, the elites in the medical system, in the industrial complex said, oh, we're going to make it easy for doctors, and we're going to have a hospitalist. Okay. And so they broke the continuity of the doctor-patient relationship. And it is that breaking of that continuity that I believe destroyed the field of medicine.
When do you think that took place? Because I get a sense that it took place around the late 80s, early 90s, because that's when I noticed a lot of drastic changes in the healthcare system.
That is correct. So during the 80s, the hospital, late 80s in particular, is when the rise of the hospitalist came, and you could work a shift at the hospital. You could leave your shift, and you were free to live your life. Okay, this was going to make it great for doctors and great for patients, because in the hospital, you would have a doctor to you. Yeah. Well, I don't see it that way.
Not today. Definitely not today. I mean, it seems like patients are just herded in like cattle. I mean, they might as well have an ear tag as well. It's terrible on how the general public is treated versus what the biggest establishment of the hospitalizations has treated the people. And it was actually, I think it was the late 90s, a friend of mine who was just working janitorial at a hospital, attending some meetings, saying, Tim, you do not want to go into the hospital because you're nothing more than just a model number for a refrigerator.
And I think the other things that we need to remember is how there are certain states, and this is a big issue right now in North Carolina, where they're allowing foreign medical grads to come in different nursing, medicine, not have certifications that American grads have, all right? Yeah. And that not having the training, not having this testing, maybe not even proficient in English, okay? And yet they want to put these so-called doctors or so-called nurses into what they call healthcare deserts. So our most vulnerable people are going to be provided with healthcare by so-called physicians, nurses who may not ever have been trained or certified.
Wow. I want to give a quick reminder to the audience, even though there's a doctor in the house, I'm glad that Dr. Sheila is here. We are not here to give medical advice Definitely seek the opinion of your own physician and not take ours. This is for educational or entertainment purposes only. So just a quick, disclaimer there. I don't want us getting in trouble.
That's correct.
Got to mind our P's and Q's here while we have the opportunity. Because knowing me, I thought about it like 5 times already. I'm like, I keep forgetting to say it. I got to jump in and say it. So here
Thank
we are
you.
saying it. Yes, you're very welcome. So let's the hospital system has just been gone, since the late 80s. Wow, I mean a little earlier than I thought. When I was in California, I was able to just go to my doctor, $25 on the table, no insurance involved. I was able to see, my doctor, my general practitioner, which was a family friend. He knew my grandparents, he knew my parents, he knew me, some of my friends, and that whole interaction of having that friend, I don't think exists anymore. The last doctor I saw, which is near 2.5 years ago, who took over for that doctor. I actually have his personal cell phone number, which doctors typically don't give out to patients, but I can give Dr. Pete a call anytime, and I choose not to because I'm a patient. I think there's that little bit of a separation there. But let's get back around to good old Anthony Fauci. Anthony Fauci has been recently in the hot seat. So we played a little short video from Joe Rogan on Anthony Fauci's involvement with the HIV/AIDS pandemic. And I remember what a crazy time that was as well. But Fauci's in the hot seat again. So I'm going to play a short little video clip. I believe I found it on Fox News about Tulsi Gabbard releasing quite a bit of information.
On her final day as Director of National Intelligence, Tulsi Gabbard released a new set of declassified documents focused on Dr. Anthony Fauci. In a video posted last night, Gabbard accused Fauci of funding risky research at the Wuhan lab with taxpayer dollars and misleading Congress about that. Fauci has not commented on the release. He received a preemptive pardon from former President Biden in 2025. Gabbard stepped down to care for her husband during his battle with cancer.
Fox 11 Weather is sponsored by Yamava Resort and Casino.
So I'm going to pull that clip right now because it goes into the weather. But this pre-pardon thing, that's almost like, I know you did something wrong, but I'm going to, give you a break here. Here's your get out of jail free card. That's just such a terrible thing for at the time, the sitting president to do. Make it make sense. I mean, I'm not asking you, Dr. Sheila, but it's mind blowing.
It shows that everyone was complicit in the lie.
Yeah.
And the gain of function research that was done all over the country, all over the world, in labs, it was supposed to have been stopped. It continued to go on. Fauci directly lied to Congress. I watched the testimony of Senator Paul interviewing him, and how he twisted and turned every single word. We're not doing that. We're not doing that. In fact, they were doing the research, and the research was specifically done on lung tissue. And it was specifically done to make it invasive to the lung. All right. And so you are doing research, deadly research. All right. And then you're doing, all of this, mock stuff, your game plan about, a potential pandemic and how the world would respond to that. This was the playbook. And the prior runs at this, when you went back to the swine flu and other SARS-1, all of this, were just ongoing Fauci, running the playbook. Can we make this go worldwide? Can we make this go viral? And even after COVID, all right, you have to look at this. Then we had monkeypox. Yeah. And we had the avian flu, and, the Ebola's thrown in there. Ebola's in there again. Yeah. Okay. So it's all about how to control the people, how to get, like, I went to an avian flu conference, and they said, it's really important that we be able to control the population, and that, and almost gleeful in, if people have chickens in their backyard, we want their neighbors to be able to report them.
Wow.
And so very much like during the height of the pandemic, all right, and I use that term loosely,
Yeah.
that they want, if you were having too many people over to your house for a holiday event, that you should be reported.
Yeah, I remember that. And yeah, you were allowed to have a funeral with 30 people or less, but you cannot have a Thanksgiving dinner. So
Correct.
we were having a funeral for our pet turkey. I mean, I hate to make it sound like a joke, but we had to use whatever we could to get through this whole government takeover, which was just terrible. Especially in the state of California. I believe New York was a very similar situation. These governors that are supposedly running the show are just taking their people down.
And what's even more criminal is one of the ways that they're using vaccines now is, in some hospitals, if you are a grandparent going in to visit your new grandchild, they don't let you visit unless you've had a recent DTaP shot.
Wow.
All right? There's no reason for that.
No.
All right? And yet, and so you're a new parent, you're walking into the hospital, you're saying, I'm seeing my new grandchild, and no, you can't go on the floor unless you have a DTaP shot. And we're right here, we've got it ready for you.
Wow. It's like premeditated. I want to play a quick little video clip from Josh Hawley. He calls out Dr. Fauci at a COVID-19 whistleblower hearing. Okay. And wow, yeah, I'll drop the link in as well where people can view it after the show.
Reported gain of function research to the Wuhan lab, lied about it to Congress, lied about it repeatedly to the chairman, as I recall. So his hands are dirty in this. And yet here he is intervening behind the scenes. It's bad enough that he's out there misleading the public. Behind the scenes, he's trying to intervene to stop our own intelligence community, who are supposed to work for the public, from actually accurately assessing the evidence. This is unbelievable. This is unbelievable. And then people wonder, gee, why are the American people not trusting of elected officials? I wonder, why are they? I'll tell you why, because we are repeatedly lied to by these people. Lied to and lied to and lied to. I want to thank you, Mr. Erdman, for your testimony. I just want to note, I think we've only scratched the surface here. Thank you, Mr. Chairman, for calling this hearing. And I just want to point out, when you've got a witness who's saying under oath that the report that the government issued lied to the American people, that it is false, we've got a big problem in this country. We've got a big, big problem, and we haven't begun to solve it yet. Thank you, Mr. Chairman.
And he's absolutely right. There is a big, big problem.
And that was great testimony from Jim Erdman. It was profound. I congratulate him. I congratulate not only the work he did in exposing that, but his work with Feds for Freedom and all of the work that they've done as an organization to expose all of this. Yeah. And it's really critical that this work continue to be exposed and that people are held accountable. Not just Fauci, but the whole chain of command needs to be held accountable.
Yeah, absolutely. Now I get a curious question. Do you think, as Fauci being up there in his rank, do you think President Trump received bad advice from Fauci and pushed forward this Operation Warp Speed? I'm just curious on what your thoughts are, in your opinion.
I think he was directly lied to by Fauci, Birx, everyone. Wow. And that he did not have the medical knowledge to do that. And I think that the people that tried to reach out to him and slow the power of Fauci were probably squelched and said, those people don't have the authority that I've had in the 30 years of glowing experience I have. And so their voices were not heard. The pharmaceutical industrial complex was clear. The military pharmaceutical industrial complex was clear about what the president was going to hear and what he was not going to hear.
Wow. Yeah, because I remember President Trump saying, "Go out and get some sunlight." They actually mocked him for him saying something about bleach in the veins, and that was a very interesting thing. I think he was talking about alternative treatments, not actually Clorox or excuse the brand name, but actual bleach. And then the media completely mocked him. It was terrible. So I want to play a quick little video from Senator Rand Paul. Showing the powerful influence for decades that Fauci has had.
Fauci's been influencing the process, and it from the very beginning looks like his interference in a lot of different segments, his interference in the scientific journal articles, interference in intel, but he had a 40-year abuse of power career. People talk about J. Edgar Hoover. J. Edgar Hoover's got nothing on Anthony Fauci. 40 years of placing all his lieutenants in all the positions. And then after 9/11, the funding for bio research and bioterrorism went through the roof, and he became the kingpin that had access to all of that money. So it just, I go on for hundreds of pages in my book talking about this, because the abuses of power and what he did are, endless. I referred him twice to the DOJ under Biden for criminal prosecution. They never acted on it. I've referred him twice to the Trump DOJ without action on it. They may say because of his pardon they can't prosecute him. I think that's an open question. I think the courts, in all likelihood, probably will side with the pardon, but there are some questions. Can you pardon somebody for a non-specific crime? Is it too vague to say, I'm going to prosecute you for not prosecute you and pardon you for anything you did in the last 10 years? I think there's a possibility the court says that's vague and not specific, and you can't give people some kind of pardon for everything and over such a long period of time. I think there's a chance we'd win that. I think it ought to be fought.
So that was on the New York Post, which is surprising to see that, because New York Post usually leans a different direction. But again, this is to be investigated, as Matt and myself talked about this last Tuesday, that investigations can take months or even years. So we're still into the beginning stages of it. Some of that Josh Hawley video that I played, there's a little a bit more at toward the beginning of that video, which I put in the comments, that a lot of things were redacted. So it was very unfortunate that redaction takes place. First of all, I can understand the general public doesn't need to see everything, but people like Rand Paul, Josh Hawley, and some of these well-rounded minded politicians need to see things so they can make a sound decision, just like doctors need to be well informed so they can properly inform their patients. Dr. Sheila, what's your thoughts?
I agree with Senator Paul. I think that you can't give a blanket pardon like that. And I also think the auto pen, needs to be called out.
Yeah.
And that what Fauci did, crimes against humanity.
Yes.
Right. This is the level of deceit and corruption that our nation is facing. And if we don't hold anyone accountable, then that is the biggest message that we are sending, that you can do this. The elite class can do whatever they want. They can use us however they want and never be held accountable. And is that the message Trump wants to send? I hope not.
I hope not either. And accountability should be held. I mean, that should be something that has not been done since the Clinton era. I mean, because even Bill Clinton was not being accountable for his relations with Monica Lewinsky. And he was in recent history, impeached. Out of the two presidents in our near 250 years of being the United States of America, only 2 presidents have been impeached, and Bill Clinton was not, fully upfront and led to be accountable. They had to be, found in the court of law, or he should have just said, "Yeah, I did it. I bowed my head. I'm gonna, take a walk of shame." He didn't do that. So there's been a lot, and there's been accountability issues even prior to that, but it's not as big as what's going on today. It's very detrimental to our society. The people can't just I dropped a piece of trash, I need to pick it up, or I did bad, I need to step forward and fix it. And
we absolutely need accountability, and I think it's at every level. And right now, as the fraud within the medical system, is being exposed. All right. And all the Medicare fraud in Minnesota, Virginia, California, wherever you are. And legislative bodies are taking direct action to prevent that.
Yeah.
Right. So what kind of message are you? It's okay to rob. It's okay to steal. It's okay to do whatever you want, because the government is never going to hold you accountable. And yet we as a taxpayer are asked to give more and more and more with nothing in return. And that is our duty to do that. Well, there is a breaking point.
Yeah, I'm glad the DOJ is finding the fraud that's going on with the health. I believe it's Medicaid, or is it state Medicaid, or is it the Medicare, or both?
Medicare, and it's at both levels.
Okay.
Right? There's Medicaid fraud, there is Medicare fraud,
Yes.
There's fraud throughout the system. And when you really think about that level of fraud, the hundreds and hundreds, if not billions of dollars, and I'm willing to say hundreds of billions of dollars in fraud, and then real people are struggling who have paid taxes their whole life, and it's all given away to somebody else because you're not of value to the, all right? Your value is completely dismissed.
This actually, puts things in a detrimental situation to not just the quality of healthcare, but also the cost of healthcare. Because every time someone steals something from a store, the consumer takes it. You're getting stolen from it through healthcare insurance, which in this case might be a state Medicaid or a Medicare, and so that raises the cost of just the healthcare system itself, and it's terrible.
It's at every level. And even the Medicare system, I can speak directly right now to some Medicare situations, is that I had a patient who turned 65.
Yeah.
He was on a medication that cost a lot. All right. It was about $3,000 a month prior to turning 65.
Yeah.
When he turned 65, Medicare would no longer pay for that drug, but we'll pay for a drug that costs $6,000 a month.
Whoa. Wow.
Okay. And the issue is the drug that it cost $3,000 a month he was able to tolerate, had been stable on for 10 years.
Okay. Yeah.
Okay. Then after that goes through 1, 2, 3, 4, probably 5 medications in which he had severe side effects from. All right. And each of those cost time, money, and his overall quality of life.
Yeah.
That's unacceptable.
It's not acceptable at all.
And when you also look at all of the things, when you look at the 70 plus shots we're giving our children.
Yeah.
Right? And our children are the sickest in the world.
Yeah.
And yet when we compare vaccinated to unvaccinated children, and we say the unvaccinated children are healthier, then we're demonized.
Yeah.
Right? And when you don't look at real things that contribute to vaccine injury, okay? So children who have limited ability to metabolize folate are at increased risk for vaccine injury, right? But we're not able to talk about that. We're not able to test for that because it's more important that we follow the protocol. The protocol is you come in, you get your shots, you do what we say, all right? So you are, you're just a subject of the government.
Yeah.
And this has to stop.
Yes. Absolutely. Well, it was about 8 months ago, I believe it was, there was this uproar about acetaminophen and it causing autism.
Mhm.
Now, to my understanding, that was actually in conjunction of just shortly after receiving a vaccine. What's your thoughts on that? And this is just your personal opinion, not professional.
My personal opinion is I think it's multifactorial, but I think fundamentally that the shots have neurotoxic ingredients in them.
Yes.
Those neurologic toxins are given and they beginning on day one of birth. And in particular, as each group of shots is given, the toxicity in the brain, the child's inability to metabolize and rid their bodies of the toxins causes a neuroinflammatory response. And that leads in the severe cases, autism, okay? And in non-severe cases, I think the high level of learning disabilities, ADHD, other developmental delays. Further, when we look at the vaccines, okay,
yeah.
And when you read a package insert, what it says is it contains not less than X amount of live viral products. Okay, so I want you to think about that.
Yeah.
Not less than. What's the high number?
Right.
Okay, and so if a shelf life of a vaccine is 2 years,
yeah,
and at the end of the 2 years, it still has to be equal to or greater than 3,000.
Yeah.
How high do you have to start at day one so that day 720, there's 3,000?
Right.
And so then what happens in that bottle when you have a lot of live virus on day one and you get the shot on day one, and then on day 720, you have a lot of degraded, dead viral products.
Right.
What is the impact in the same lot on the individual child who is getting those? And so what happens is are you going to get more neurological injury on the first day and more autoimmune on the last day?
Right. Yeah.
But then you've got this slope in between, which is a crapshoot.
Yes.
All right. And so why are we not going back and saying, how do we support the immune system? How do we give children the sunlight? Okay, the importance of sunlight. How do we support their immune system so that when they do get a viral illness, it isn't devastating?
Right.
Bring back the chickenpox parties.
Yes.
Bring back the measles parties that we had when we were kids.
Yeah.
Okay, where everybody got them at the same time. All the moms knew it. Okay, we got a round of chickenpox. We got a round of measles.
Yeah.
And one of the important things in terms of that is that the rate of, in particular, chickenpox, is the rate of shingles was considerably lower than it is today.
Yeah.
And everybody had the chickenpox. And now, what do we see? We have younger and younger people suffering from shingles.
Yeah.
And
Yeah,
so
sure.
the whole concept of we're going to prevent shingles has not occurred. And in fact, we've increased the frequency of shingles because we didn't let children get a normal childhood illness.
But guess what? They have a vaccine for shingles, which I'm not going to get. And a friend of mine actually recent over in Colorado went to a shingles mixer, basically like the parties you're just talking about with the measles and the chicken pox. Yeah, to get the shingles purposely. You know, she's in her mid to late 50s, and she's choosing to do that for the better of her own health. She used to work for the pharmaceutical industry and has totally taken a 180 on that and has chosen the holistic methods more so than not. Definitely a shout out to my friend Hawley for what she's doing. I think she's taking the right approach, in my opinion, on that. So we've definitely gone over on time. We will have to have you back, especially when Tanya's on board too, because Tanya's a wonderful co-host and we miss her greatly. She chose to take the evening off, but you have an event coming up September, correct?
September 12th, we have a very exciting event in Virginia Beach, Virginia. It is Health Choice Liberation from Mandates. And we have a full day of really outstanding speakers. Dr. Paul Merrick will be our keynote, who will be addressing the pandemic of cancer. But we also have Jeffrey Tucker from the Brownstone Institute. We have Patrick Carawell, who is from HHS. We have Steve Caroling, who will be he's a whistleblower from Merck. All right. Always gives an exciting talk. Maureen Diaz from Weston A. Price. We have Gary Porter, who's going to talk about the Constitution and healthcare. James Kelly, Chrisanna Shackelford, and Kathy Hudgens are going to do a roundtable discussion on the interface between the patient and doctors. And Daphne Kasparek and Pamela Burnham are going to talk about vaccine injury. And Charles Froman from the National Health Federation is going to talk about our environment and the dangers from our environment, and that also interface with the government.
Wow. So I want to bring up the front of the flyer again for the audience to see. And I already put the website into the chat. So what are some ways that you could be found on social media?
So our website is vamfa.org. All right. We are on Facebook. We're on X. We're on Rumble. We're on Instagram. And if you just look at Virginia Medical Freedom Alliance, and if you even go to our homepage, all of our links to social media are there.
So I'm plugging everything into the chat right now as we speak. The X took a moment. Let me get the Facebook and the Instagram and the TikTok in there as well. But yeah, I'm glad you're available on so many different platforms. I could be better. I could be worse. But definitely great to have you on. We definitely have a lot more to talk about when it comes to vaccines, because we talked about some other things earlier today that we didn't get a chance to talk about today, unfortunately. But we've gone overtime, which is, I love going overtime. It's always wonderful to do that. It's always good to have a good friendship with the guests that I have on, and I think it's important. It's just like the friendship between a patient and a doctor.
Absolutely.
So let me drop that Instagram link in there, and then we'll go ahead and just tell the audience, be sure to find Patriots 3 at Tim Holliday TV. That's TimHolliday TV, no spaces. You can find us on iHeart, Spotify, Apple Podcasts, Rumble, YouTube, Facebook, and Twitch TV. So until next time, ladies and gentlemen, be sure to join in on Tuesday for Matt and myself. And we always put together a wonderful show. Like, share, and follow. That actually helps with the algorithms. Leave us some comments too, because that's always fun. The interaction is always great. All right, ladies and gentlemen, until next time, Dr. Sheila, thank you.
Thank you.